All right, friends. Good afternoon. How are you? Let's have some conversation. Let's have some conversation. I have a few minutes with you guys. What causes low blood sugar without diabetics? We're going to be discussing what causes low blood sugar without diabetics. Okay, that is going to be the title of this video. What causes low blood sugar without diabetics? So while I've given you guys the heading, I'm going to exercise some patience. I'm going to wait. Let me see. Before we start, I want to make sure at least we have people join the program. So let it load. Let all the people, let them join the program, and then I will start while I continue doing what I'm doing on the computer. All right. So just exercise patience. If you don't see me talking, don't lose hope. I'm just waiting. I'm looking at the screen here. Let me see everybody join the program. Then I will start the program. So if we can squeeze in 1 hour today, that's fine. All right. This unannounced broadcast. I was not scheduled to do broadcast this afternoon, this morning, or even depending on your location, but I decided to squeeze in this time. This list this specific news. Okay. So if you have any question, please paste it on the comment section. If you have any question, okay, leave it on the comment section. If you have. We're going to be discussing what causes low blood sugar without diabetics. Okay, do you have low blood sugar without diabetics? We're going to answer that questions, another series of other questions. This particular topic I have a series of questions, so it's going to be a kind of question and answer on this. So we're going to discuss what causes low blood sugar without diabetics, or more or less, I would say hypoglycemia without diabetics. So we're going to look at what is hypoglycemia without diabetics. So we're going to look at the symptoms, the causes, who can develop it, the treatment diagnosis, complications, and then prevention, and then I'll give you guys my own final takeaway. All right, so let's wait for everybody. Is it Tile Guy 9? Welcome. All right, so that is what I'm waiting for. Let me see how many people is available to join the program. All right. So while I'm waiting, let me continue doing what I'm doing, and then we'll take it from there. So I'm waiting for everybody to join the program, and then we start. We're going to be looking at what hypoglycemia without diabetics. Hypoglycemia without diabetics is what we are going to be looking at. I'm waiting for everybody to join the program, and then we'll start. We're going to be discussing hypoglycemia without diabetics. I'm going to be discussing about hypoglycemia without diabetics. So, all right, we're going to be discussing about hypoglycemia without diabetics. How are you guys? I'm waiting for everybody to join the program, and then we'll start. Okay, so we're going to be discussing about what causes low blood sugar without diabetics. What can cause you to have low blood sugar without diabetics? So indirectly, I'm talking about hypoglycemia. Hypoglycemia is low blood sugar. Hyperglycemia is when your sugar levels are too high. And hypo is when your sugar levels are down. So what can cause you to have low blood sugar and you are not a diabetic? Okay, have you heard about that? Hypoglycemia, you went to the hospital and you have a low blood sugar, but you're not a diabetic patient. So what can cause you have a hypoglycemia? What can cause your sugar levels to drop when you are not a diabetic patient? So we're going to look at the symptoms, the causes, who can develop hypoglycemia, who can develop low blood sugar even though they are not a diabetic patient, how do you diagnose this, what are the treatments, and then what are the complications, and also how to prevent it, and then we'll go to the final takeaway. So these are the sequences, the way I'm going to address this issue if you are following me. So let's take a look at, we know the difference between hyper and hypo, hyper high, hypo low. So as I said, people with diabetics, okay, can get, don't mind, I'm doing some other things on the computer, so I'm multitasking while I'm doing this video. I'm looking at something. As soon as it finishes downloading, I'm going to just click it. So people with diabetes can get hypoglycemia, all right? Hypoglycemia, people with diabetics. If you're not a diabetic patient, you can still have hypoglycemia. If you're not a diabetic patient, you can still have low blood sugar levels, okay? So this can happen if you take certain medications. Certain medication can push your sugar level to go down, okay? Have a severe infection. There are different levels of infection, but a severe infection can force your sugar levels to drop, okay? Or have other serious issues affecting your organs. So we have three scenarios that you can have a low blood sugar and you are not a diabetic. One is taking certain medications. Certain medications can push your blood sugar level to go down, okay? And again, you have a severe infection. A very severe, serious infection can force your blood sugar levels to drop. Or you have a serious issue affecting your organs. This can cause your sugar level to drop. Okay? So even though you are not a diabetic patient, this can trigger your sugar level to drop. All right? So I've given you guys three scenarios that can cause you to have hypoglycemia or low blood sugar level. Now, what is hypoglycemia? Hypoglycemia is a condition that occurs when your sugar levels do what? Drop, or your glucose level drop. Okay, you have hypoglycemia. There's a threshold. Every person have a threshold. Your sugar level is supposed to be within that threshold to be normal, and your sugar level is supposed to go below that threshold to be low or high. So many people think of hypoglycemia as something that occurs only in people with diabetics. That is not the truth. You can still have hypoglycemia and still not be a diabetic patient. Okay, however, it can also occur in people who doesn't have diabetics. All right, it can all occur on people who are not even a diabetic patient. So it can happen in people who don't have diabetes, but at the same time who have other underlying conditions, or they are alcoholic. They are taking too many drinks. So alcoholic, if you're a too much drinker, take too much of alcohol can also contribute for you to have a low blood sugar levels. Okay. Now hyperglycemia can happen in people with diabetics also. So when you're a diabetic patient, then suddenly you can experience hypoglycemia from time to time. Also, you can also experience hyperglycemia from time to time once you're diabetic. So there's a fluctuation of your sugar levels all the time. So you can experience low blood sugar levels and high blood sugar levels from time to time if you're a diabetic patient. But the surprising thing is that why should I have a low blood sugar levels even though I'm not a diabetic patient? And I've given you guys 3 scenarios. Taking certain medications can cause your sugar levels to drop. And that is why you have to also seek doctor's consent before taking certain medications if you're already a diabetic patient, or even if you're not a diabetic patient. Some of these over-the-counter medications can force your sugar levels to drop because of the interaction. Now, if you have a severe infection can cause your sugar level to drop, and you're not a diabetic patient, or you have a serious issue with your major organs. This can happen to cause your sugar levels to drop. All right? So that is it. So hypoglycemia can happen in people with diabetes if the body produces too much insulin also. So if your body produces too much insulin, more than required, can cause your sugar level to drop. So if your body produces too much insulin, it can cause your sugar level to drop. Okay? Now, this hormone is responsible to break down sugar so that you can use it for energy. When it pushes it into the cells, that is where it's being converted, broken down to be used as energy that we need for our body to function daily. You can also get hypoglycemia if you have diabetes and also you take too much insulin. So these are the scenarios, either you're a diabetic patient or you're not a diabetic patient. These are the scenarios that you can have hypoglycemia, your sugar levels to drop. Take note. All right? Take note. Now, I have a question here because this program I'm doing is mostly, I'm going to go discuss it mainly as questions because I have a couple of questions on it. I have discussed this issue before in one of my videos, but I'm going to discuss it again. This question says, can you have hypoglycemia without having diabetics? I've answered that question. Maybe you didn't follow me from the beginning. Can you have hypoglycemia without having diabetics? Hypoglycemia means you have a low blood sugar. And this person is asking me, can I have a low blood sugar levels if I'm not a diabetic patient? And the answer is yes. There are 3 scenarios that you can have low blood sugar levels if you are taking certain medications. Certain medications can force your sugar level to drop down. Second is that if you have a severe infection, there are different levels of infection. A severe infection can force your sugar level to drop. And thirdly, if you have a serious issue with your major organs. If you have a serious issue with your major organs, that can force your sugar level to also drop. So to answer your question, yes, you can have hypoglycemia, low blood sugar, even though you're not a diabetic patient. All right? So that's to answer your question. Now, yes, hypoglycemia can happen when you don't have enough sugar in your blood, or if your body cannot, stabilize your blood sugar levels. You are right? Now, do you know the threshold? Before your sugar level drop, do you know the threshold? It is important to know the threshold so that when you measure your sugar levels, you're able to understand the reading and to know when your sugar levels are high, normal, or low. Now, I believe I've answered your question. Now, people without diabetes, when your level drop below, Cynthia, I believe I've answered your question. When your level drop below 55 milligram per deciliter, if your level drop below 55 milligram per deciliter, you're experiencing hypoglycemia. I've seen patients that have this, less than this. Okay? So I've seen patients that have less than this. Now, low blood sugar means your body doesn't have enough energy to properly allow your body to function normally. All right? As I said, the excess sugar that we accumulate in our bloodstream that we push into the cells, because the excess of the hormone is to break down those excess glucose levels and then push them into the cells where they are needed for energy. So that is why when the body releases hormone, it breaks down those excess glucose levels floating in the bloodstreams and direct them into the cells. In that cell, they are being converted into energy our body need. So when you are running, when you are sitting, when you are dancing, when you are walking, whatever you are doing, you are burning those energies. That is why when those energies are depleted, you become weak and tired. You can't even function. You will find it very hard to talk because you are weak. There's no more energy in you. Then that is when you have to boost it up because your sugar level have dropped below the threshold. All right. All right. So now, okay, I believe Cynthia there's another question, but I'm going to come to that. Now, if you're a non-diabetic patient, all right, non-diabetic patient, hyperglycemia can result from using certain medications, severe infection, consuming too much alcohol, skipping meals. So skipping meals, underlying health conditions, or you have issue with your major organs, these can cause your sugar level to drop. These can cause your sugar level to do what? Drop. Now, one thing you guys don't understand is that if you think that skipping meal, people think that skipping meal is going to make them their sugar level not to go high. No, you're going to get the reverse. As a diabetic patient, you are not advised to skip meals. You must ration your meals, break them down into intervals. And that is why you have to break down your meal into intervals. But skipping meal, believing that it's going to make sure your sugar level doesn't rise, no, you're going to get the reverse. Because the more you skip meals, your sugar levels are depleting. And that's when you're going to experience hypoglycemia. Okay. Now, let's see what other question. This everybody know. This one is what are the symptoms of hypoglycemia? All right. Okay. I believe all of you know the symptoms of hypoglycemia. Now, hypo is asking of what are the symptoms. It's asking of what are the symptoms of hypoglycemia. What are the symptoms of low blood sugar levels? That's what he is asking. Now we have somebody can also ask me what are the symptoms of hyperglycemia. This is hypoglycemia. So moreover, the person is asking me what are the symptoms of low blood sugar levels. Now I'm going to talk in general. Most of the symptoms of hyperglycemia, hypoglycemia, or diabetics in general are similar. Okay, most of the symptoms are similar with notable differences. Okay, so if you look at symptoms of hypoglycemia compared with the symptoms of hyperglycemia, you see that there are similarities in them. Then in totality, when you look at the symptoms of diabetics, you see that there are similarities. There's not much differences in either one. So let's look at the symptoms of hypoglycemia. Okay, now everyone react differently. Your symptoms might emerge differently from the other patient. Our symptoms don't emerge the same time in the same direction. Our symptoms differ individually. Our body reacts to our symptoms differently. So don't expect your symptoms to be the same with your friend's symptoms. No, our symptoms react differently from our own body. The way I'm going to react to my own symptoms for it to show is going to be different from the way you're going to react from your symptom for it to show. So don't expect your symptoms to be universal to everybody. No, they are peculiar to individuals. So let's look at the symptoms of hypoglycemia. The symptoms of hypoglycemia is dizziness. Susie, thank you very much. The symptoms of hypoglycemia is dizziness. Okay, one. Okay, the symptoms of hypoglycemia, one is dizziness, pale skin. I believe you guys are writing it down. Dizziness, one, pale skin, tingling or numbness in the lips, cheeks, or tongue, sometimes in your feet. But numbness, tingliness in your lips, cheeks, or tongue. All right. Now, seizures. Seizures is a symptoms of hypoglycemia, but mainly seizures comes towards the end. Because when your sugar levels start dropping, there are stages before you get to the seizures, coma to seizures, before you go into coma and then seizures. So there are stages when your sugar level start dropping. It doesn't take you straight to seizures, except you've been ignoring it for a longer period of time, not knowing that your sugar level have been dropping, and then by the time you notice it, you're in that stage of seizures. So there is seizures, there is extreme hunger, there is headache, there is confusion. Confusion always comes before seizures and coma. Okay, there are 3 different stages of hypoglycemia before it gets to confusion, coma, and seizure. Confusion always comes first. Now we have inability to concentrate. So you see, this inability to concentrate comes before, after confusion. It goes into inability, because when you are inability to recognize your environment or to concentrate, you are going into seizure, because now your blood sugar level have dropped below 15 milligram per deciliter. So that shock is kicking in. That is when you see that your eye is fixed. You cannot swing your eye left and right. It's fixed because you cannot, the inability for you to recognize your environment or concentrate is no more there. You are going into seizure, and that can lead you into death if you are not being resuscitated back to life by boosting your sugar levels up. Okay? So inability to concentrate, sweating, shaking, blurry vision, and personality changes are some of the symptoms of hypoglycemia. Okay, these are some of the symptoms of hypoglycemia. That is, when we're talking about hypoglycemia, we're talking about low blood sugar levels. All right, so those are the symptoms. As I said, some of these symptoms are similar to hyperglycemia. Now, hyperglycemia means hyper, H-Y-P-E-R, means hyperglycemia means your sugar level is high. Hypo, H-Y-P-O, means low. So hypo, this person is asking me, what are the symptoms of hypo, which means low blood sugar levels. Okay, low blood sugar levels are the symptoms I just enumerated here. And then most of these symptoms are similar to hyperglycemia. Most of these symptoms are similar to, in generality, in totality, with diabetics. Okay, so you may have hypoglycemia without even symptoms. I have seen patients, I have seen individuals that have they have been living with diabetes for 6 months, a year, not even knowing that they are diabetic. The only time they realize they are diabetic is when they fall into a serious health issues. They are being taken to the hospital. Then they realize that, oh, you know what, you have some damages in your nerves because you're diabetics. So sometimes some of those symptoms, you can't even notice them. Sometimes you notice those symptoms and then you keep ignoring it, thinking that, oh, it's going to go away. Do not disregard a minute symptoms that emerge in your body. Never you ignore any minute symptoms you experience. If you experience any minute symptom, take note. Okay? I don't know why I'm sweating. If you experience a minute symptoms in your body, take note of the date and time you experience it. It's very critical because the doctor is going to ask you, when did you start noticing those symptoms? Take note of that minute symptom, write it down, date and time, and wait. And keep watching your body to see if that symptom is going to continue. Sometimes those symptoms is going to come, disappear for some days, and reappear again in a little bit higher mode. Sometimes it's going to disappear and come back. So you have to keep taking note. If it stays in there and disappear, wait. See if that symptom is going to come back again. Then that's when you get taking note that something is definitely wrong. That first symptom that is minute is a warning to go and see your doctor. Something is wrong with your health. It is when you keep ignoring those minute symptoms, you start progress from stage 1 to stage 2, stage 3. By the time you get to the hospital, it's stage 4, and it's already too late. All right. So that is why you have to take it very seriously. Take it very seriously. I always preach that do not ignore any symptoms you've seen in your body. That means it's telling you something is not right with you. So act on that for you to save your life. Symptoms comes in different forms, and once you notice it, take appropriate action to visit your doctor and then seek a medical advice. All right? Let's go to the next one. Question number 3 says, what causes hypoglycemia? I've answered that question. Those are it means you guys just joined. You just joined. I've answered this question twice or thrice. What causes low blood sugar levels? I've said it several times. Now, one thing you got to understand. Okay, I'm going to give you some examples, what causes it, and then we are going to go into details. Because when it comes to hypoglycemia, we have the reactive hypoglycemia and we have the non-reactive hypoglycemia. We have two classes of hypoglycemia. We have two classes of low blood sugar levels. We have the reactive and non-reactive hypoglycemia. But I'm going to give you guys a general causes of hypoglycemia, and then I will explain to you guys when you are having a reactive hypoglycemia and non-reactive hypoglycemia. Okay? I'm going to explain to you why you are having reactive low blood sugar levels and non-reactive low blood sugar levels. Now, what causes hypoglycemia in general? Medications. Certain medications can force your sugar levels to drop. Severe infection can force your sugar level to drop. And some major issues with your organs can also cause your sugar level to drop. Taking too much excess alcohol can cause your sugar level to drop. Okay? Too much insulin in your body can cause your sugar level to drop. These are some examples, few examples of causes of hypoglycemia where you have low blood sugar levels. Now let's go into the reactive and non-reactive hypoglycemia. As I said, we have two types of hypoglycemia. We have the reactive and the non-reactive hypoglycemia. What does it mean? What does it mean? All right. Now, your hypoglycemia or your low blood sugar could either be reactive or non-reactive. These are the two types of hypoglycemia, and they have different causes. What can cause a reactive hypoglycemia, a reactive low blood sugar level, might not be the same thing that causes a non-reactive low blood sugar levels. Okay? What can cause you to have a reactive low blood sugar level might not be the same thing that will cause a non-reactive low blood sugar levels. So we're going to look into these two. Keep sending the question. I like these questions you guys are sending. It means you guys are engaging. All right? Now, let's look at reactive hypoglycemia. What is reactive hypoglycemia? You have to understand what it is before you understand what is the cause of reactive hypoglycemia. Now, reactive hypoglycemia occurs within a few hours after meal. Remember, we are talking about low blood sugar. Why should I have a low blood sugar level just a few hours after I finish eating? I shouldn't have low blood sugar. I just finished eating. Why should I have a low blood sugar level when a few hours after I've just finished eating? That is what is called reactive low blood sugar levels. That means you are having a reactive low blood sugar level a few hours after you just finished eating. Now, this could be why? The question is, why should I have a low blood sugar levels just few hours after I have just finished eating? Why? Because I shouldn't have, my sugar should not drop. I just finished eating a few hours, 1 or 2 hours ago, and then my sugar level have just dropped. Why? Now, it's just one cause. One cause could cause you to have low blood sugar level just few hours you just finished eating is because you have overproduction of insulin. Your body produces too much insulin, okay, that causes a reactive hypoglycemia, that causes your sugar level to drop because your body all of a sudden produces too much insulin and then forces your sugar level to drop. Okay, now having a reactive hypoglycemia may mean a risk of developing diabetes also. That could be a symptom, a warning sign, an amber light you are about to develop diabetics. And that is why you need to consult your doctor immediately. That is why you need to see your doctor immediately. That's a warning sign that you're about to develop diabetics. That is what is called reactive hypoglycemia. Now, what is non-reactive hypoglycemia? Okay. Now, non-reactive hypoglycemia does not necessarily mean it has to do with the meal you consume. Okay? It does not necessarily mean it's the meal you consume. It may mean something different. It may mean you have an underlying condition, an underlying health issue that is causing you to have non-reactive hypoglycemia. Okay, one is fasting. The causes of non-reactive hypoglycemia, one is fasting. Okay, that is why you don't need to skip meals. People think that when they are skipping meals, they are helping themselves to avoid hyperglycemia. No, that is wrong. All right. I love that name, Mama Bobo. That's name is funny. That's typical African name, Mama Bobo. I love it. What is it? What's the meaning of Mama Bobo? Can you tell me what it is? All right. So let's look at other causes of non-reactive hypoglycemia. Remember, it has nothing to do with the meal you eat. It has to do with an underlying health issue. It has to do with an underlying health issue. Now, what are the causes of non-reactive hypoglycemia? One, I say some medications can cause you to have non-reactive hypoglycemia. Some certain medications you take can cause you to have non-reactive hypoglycemia. Okay, you're all boys. Oh, okay. All right. Thank you. Thank you very much. So we're looking at other causes of non-reactive hypoglycemia. Okay. Some medications can cause you to have non-reactive hypoglycemia. Okay. Excess amount of alcohol. Okay. Excess amount of alcohol can cause you to have non-reactive hypoglycemia. And when you see one thing people don't know, when you drink too much alcohol, it does one thing to your liver. It does one thing to your liver when you drink too much alcohol, because it stops the liver from producing glucose. Remember, in liver, the excess sugar level, the excess glucose is stored in the liver when the cells are full. So when there is no more space in the cells to absorb the remaining excess sugar level, the remaining ones are pushed to the liver to be stored in the form of glycogen. So when you drink too much alcohol, it stops the liver from producing glucose when you need it. So excess amount of alcohol can cause you to have non-reactive hypoglycemia. Now, the third one is that any disorder that affects the liver, the heart, or the kidney functioning can also force you to have non-reactive hypoglycemia. Any disorder that affects the liver, the kidney, and the heart could cause you to have non-reactive hypoglycemia, to have non-reactive low blood sugar levels. Now, eating disorders such as anorexia can also cause you to have non-reactive low blood sugar levels. And then pregnancy is the last one. Pregnancy can also cause you to have non-reactive low blood sugar levels. These are some of the few examples of the causes of non-reactive low blood sugar levels. So we have the reactive low blood sugar levels and we have the non-reactive low blood sugar levels. All have to do with hypoglycemia. Lovely question, Tony. So let's go to, let me see, there are other questions here. I won't be repeating myself. Please. Jama, is it Jama? I hope I pronounce it very well. Jama wants to know what are the I just discussed it now, but in different ways. Jama wants to know what are the possible causes of hypoglycemia without diabetics. I've discussed it. I've given you guys, so Jama, I've discussed it. You're still asking what is the cause of hypoglycemia. This is what I just finished discussing now with other terms. I would not like to repeat it again. Should I answer Jamal's question? He wants to know what are the possible causes of hypoglycemia. Should I answer it? I need somebody to respond back. Should I answer it? Somebody wants to know. Somebody wants to know what are the possible causes of hypoglycemia. Should we answer it or should we move on? TikTok, if you have any question, put it on the comment section. If you have any question for me, please put it on the comment section. Those that are watching me on TikTok, Facebook, you can direct your own, put it on the comment section. YouTube, your questions also. All right. Hey, join. Is it he or hey? How do I pronounce it? Am I pronouncing it correctly? If you have any question regarding what we are discussing, you can ask your question. We are discussing issue relating hypoglycemia diabetics. So if you have any question regarding the issue, you can ask your question. As Jamal says, possible causes of hypoglycemia. He wants to know what are the possible causes why you have low blood sugar levels. And I have said it several times. Okay, he wants to know what are the possible causes of low blood sugar for those that are not diabetic. So that is why I say, I've repeated it several times, and I'm saying, do you want us to answer that question, or do we keep going? All right, do we keep going, or do we answer that question? All right, I'm always generous in answering questions, and that is why I'm here. Jamal, I'm going to do one more favor. I'm going to answer that question. But pay attention. For those who have similar questions, this is the opportunity for you to listen. For you to listen to the response I'm going to give to this. For those who have similar questions regarding this particular issue, pay attention. I'm going to list the possible causes of hypoglycemia, possible causes of low blood sugar levels. I want to replace that hypo with low blood sugar levels so that you guys don't get confused. He says, I have a constant high blood pressure. If you have a constant high blood pressure, what have you done? Okay, it's all about dieting. If you're having a constant high blood pressure, it's all about what? Dieting. All right? Dieting. Reduce your sodium intake. If you're hypertensive, if you know you're hypertensive, reduce your sodium intake. Your sodium intake is very crucial. So if you're hypertensive, hey, or he, I'm trying to find where I'm going to pronounce that without being offensive. But I'm not being offensive because I don't know whether it's hey or he. But if you are constantly having a high blood pressure, okay, one, you're going to be responsible. Reduce the intake of sodium. Reduce the intake of what? Salt. Stay away from salt. Okay? Stay away from salt and eat healthy. Stay away from saturated fat. Stay away from saturated fat. Stay away from saturated fat. So stay away from sodium, food that contains a lot of salt. Stay away from it. Exercise, eat healthy, and stop patronizing fast food joints. I'm speaking to hey. Stop patronizing fast food joints if you have high blood pressure. If you're hypertensive, stop patronizing fast food joints. Make sure most of 80% of your food is cooked at home. Why? Because you're going to control your sodium intake, your salt intake. If you're hypertensive, you shouldn't be taking things that contain salt. That is one. Most of those food that are being sold in fast food joint contains a lot of salt and saturated fat. Those things clogs your heart and cause you to be hypertensive. All right? And you have to be on medication for the rest of your life. If you're hypertensive, you have to see your doctor to prescribe you a medication, possible amlodipine, and other medications you're going to take once a day to be there for the rest of your life. Otherwise, you go to sleep and then wake up. So if you don't eat fast food, then make sure you eat healthy. Exercise. Make sure you exercise a lot. Exercise is key to survival. All right? Exercise is key to survival, but I will advise you to see your doctor to get you a medication. You're supposed to be on medication once a day for the rest of your life. Some people think that, okay, I'm going to give you, I had a patient who takes medication, and when the blood pressure is good for a week or 2 weeks, he stops. And by the time you know it, again, the high blood pressure has skyrocketed, and rush coming back to the hospital pale. Now, when you are given a blood pressure pill, is for life. It's a chronic condition. If you're hypertensive, it's a chronic condition. It's a long-term care disease. Diabetes is a long-term care disease. It's a chronic condition. The same thing with being hypertensive. It's a long-term disease. It's a chronic condition. The same thing with cholesterol. So once you are given a medication, it is for life. You don't take it and feel that, okay, I've taken it, and then 1 week, 2 weeks, my blood pressure is okay, you stop taking your medication. No, because it's going to come back. All right, it is going to come back. So it's advisable. Our advice is to seek your doctors to get your medication. All right. Well, tell me where I'm wrong. Hey, tell me where I'm wrong. If I'm wrong, then you wouldn't be asking me, how can you control your blood pressure? You are constant on your high blood pressure. So tell me, you are the teacher, I'm the students. You asked me a question, I'm trying to... I said if you're going to be attentive and listen properly to my sentence, okay? Listen to what I said. Don't misinterpret what I said or misconstrue what I said. I say if you are hypertensive, if you are dealing with high blood pressure, stop patronizing fast food is what I said. I did not say it cause... In other ways, it can cause you high blood pressure because most of the food in fast food are used with saturated fat. Their oil is bad. Their oil is not healthy. Okay? And they have too much salt. Most of these fast food cook their food with a lot of salt. And salt, too much sodium can cause it to become hypertensive. So you don't even know where is the cause of your high blood pressure. You don't even know when the high blood pressure started. You don't know is it when you are eating high fast food joint or how does it started. You don't even know the root cause, how your high blood pressure started. But what I'm trying to say to those that have a high BP, okay, is that once you know you are hypertensive, you're going to stop consuming sodium and again, stay away from fast food joints. Okay, stay away from fast food joint. I need to do something, just a minute. All right. So you got to stay away. So what I'm trying to say, is if you are already a hypertensive patient, if you are dealing with high blood pressure, you got to stay away from sodium. Anything that contains salt, you got to limit it. That's the same thing I'm saying, that if you are dealing with high blood pressure, okay, you got to limit patronizing fast food joint. The reason why I say stop is because two things. Most fast food are built for profit. They are not built for quality, for healthy food. And that is why healthy food is more expensive than fast food joint. Most fast food joint cook their food with a lot of saturated oil that is bad to the heart. That can also cause you bad cholesterol. And also, most of fast food joint use a lot of salt. And that is why I say sodium is not good for you if you're hypertensive. And that is why I say limit your patronage to fast food joint. I did not say it's because you don't go to fast food joint, that is the cause. No, that is not what I said. I said limit your visit to fast food joint because it contains, most of their food contains sodium and bad oil. Okay? But you cannot say, if somebody asks you now, how did you get your high blood pressure? Do you know the root cause? You can't even say when it started. All of a sudden, doctor tell you you have a high BP. So that's why I say you have to understand my narratives. I did not say it is the root cause. You are not my patient. I don't know your head issue for me to say fast food joint. What I say is that you have to limit the visit to patronizing fast food because you are hypertensive. They have a lot of salt in their food and also bad oil. All right. Vasa, I'm going to answer your question. I need to, Vasa, just a minute. I need to block somebody here who is insultive. And then you that is insultive, I'm going to report your page for being abusive. Okay? Here we don't tolerate abuse. You cannot abuse. You can hear an opinion, but don't abuse anybody because you have been abusing some. I'm going to report your page for being abusive with your statement, and count yourself lucky if your page is going to be there. All right. So I'm going to report your page for being abusive. All right. All right, so I'm doing that now. So Martin, I've reported your page of being abusive. So good luck. So if you are going to be, we can engage in discussion here, but do not abuse anybody here. We can engage in discussions, disagree and agree, but what I will not tolerate in here is somebody coming here to be abusive. So Martin, what do you say? Your page is reported. All right, let me go to somebody ask a question here. Let me find that question. Somebody asked a question. I say, hold on. Let me find that question. Let me see. I know somebody asked a question here. Please ask that. I know I see somebody who asked that. Okay, yeah, Vasa, I've seen your question. It says, Vasa says, is sodium what give us electrolyte? Okay, Vasa is still there for me to answer your question. Now, let me answer that question before I proceed. Now, when you say electrolyte, that's a good question, all right? When you say electrolyte, I believe so. Vasa, are you still there? Can you confirm you are still there? So I want to make sure you are still here. Vasa, are you still there? I don't know if Vasa is still there. Now, Vasa asked a question, is sodium not something that gives us electrolyte? Now, sodium sodium is not something that has electrolyte. Okay? Sodium is not something that has electrolyte. Sodium itself is electrolyte. Because there's a different thing. You say, does sodium has electrolyte? No. Sodium itself is an electrolyte. Okay? So that's the first aspect of it. Now, when dissolved in bodily fluid, like blood, sodium carries an electrical charge. I don't know why I'm sweating here. Okay? When dissolved in bodily fluid, sodium, okay, carries an electrical what? Charge. Okay? That makes it a primary electrical minerals in our body. But the question I'm trying to address, all right? And if most of you here has a family doctor, you know, if you are hypertensive, high blood pressure, There's no doctor is going to tell you, see that you're hypertensive, and tell you go home and keep consuming sodium, even though sodium has some electrical charge that our body need. It's like the same thing. You are a diabetics. You went to see a doctor and they say you're a diabetics. And doctor says what? The doctor is not going to tell you stop consuming carbs or stop. They're not going to say sugar. Sugar is a refined carbohydrate. There is no doctor is going to tell you stop consuming carbs. Totality. No. And that's what doctor is going to tell you. Any food that you are eating that does not contain carbs is not a balanced diet. Remember, you're a diabetic. What is the root cause of our diabetes? Is carbs. The root cause why you're a diabetic is either is something that you inherit from your family or your lifestyle that causes you to become diabetics because it contains carbs. But there is no doctor knowing that you're a diabetic patient and say, from now onwards, do not eat any food that contains carbs. It's not possible. Because what? Our body needs carbs to function. All the doctor is going to tell you is reduce the intake of your carb and increase the intake of your fiber as a diabetic patient. The doctor is not going to tell you stop taking any food that contains carbs, zero. It's going to say reduce the intake of your carbs and increase the intake of your fiber. Why did he say reduce, not stop? It's because our body needs that carb to function. That is where we derive our energy to function. The same thing applies to sodium. When you are hypertensive, no doctor is going to tell you stop totality. It's going to tell you limit the intake of your sodium. Limit the intake of your sodium, not stop it, because that sodium controls electrical charge that our body needs. But it's going to say limit it. Why do I say limit it? You that is cooking at home will know the amount of sodium you add in your food. Then when you go to a fast food joint, you don't know the quantity of salt in that food that you're eating. And that is why you see your blood pressure keep rising when you keep patronizing fast food joint, because you don't know the quality and quantity of sodium in that food. But you that eat your food at home, that prepare a healthy food, know the limitations, know the quantity of salt you apply in that food. So that is why doctors are going to say limit the intake of sodium, but not stop taking sodium because of those electrical charge, electrolyte that our body needs. Vasa, have I answered your question? All right, let's keep going. I'm sweating here. I need to, let me see. All right. All right, do you have any more question? I have a couple of questions here that I want to Leo Desmara says, when he said, what do you do? Your question have to be specific. What do I do? I'm talking to you guys here. Or are you asking in response to when I say sodium? All right. I need questions because we are coming to the. I need more questions. If you have any questions on this, please ask. All right. Now, I did answer question before. Okay. The question I answered was, what is the possible cause? D. Yusha, hi, how are you? I did answer. Somebody asked me what is the possible cause of hypoglycemia, of which I did answer that question. That is where I stopped before I got a question that took me away from this. Now, I've given you guys what is the possible cause of low blood sugar levels. We've discussed the causes of low blood sugar levels in people with diabetics and also with people with diabetics. And as I was trying to explain to you guys, low blood sugar level in people with diabetics and low blood sugar level in people with diabetes, they have similar symptoms. The symptoms are not much different. So you're going to see people that have diabetics, low blood sugar levels, they are not diabetics and they have symptoms. And you see people that are diabetics and still have low blood sugar levels. Okay, so I don't want you guys to confuse on those two notions. All right, I don't want you guys to get confused on those two notions. So the possible causes of hypoglycemia, hypo means when your blood sugar levels are low. Hyper means when your blood sugar levels are high. So what I'm doing in this particular video is what are the possible causes of low blood sugar levels for those with diabetics? What are the symptoms? What causes it? That is what we are discussing here today. All right. So if you have more questions, feel free to ask your questions. If you have more questions. Now, when we talk about the possible causes of low blood sugar levels for those that don't have diabetics, we're talking about drinking too much alcohol. And when you drink too much alcohol, you know what it does? It stops the liver from producing glucose. Now, taking certain medications, okay, or certain antibiotics, okay, can also cause you to have low blood sugar levels. All right. Kidney problems can also cause you to have low blood sugar levels. Problem with your adrenal and pituitary glands can also cause you to have low blood sugar levels. Now, you have problem with your pancreatic tumors can also cause you to have low blood sugar levels. And then we have severe infections can also cause you to have low blood sugar levels. Liver disease can also cause you to have low blood sugar levels. And these causes are for those that don't have diabetics. It's not only when you have diabetes that you're going to have low blood sugar levels. You can still have diabetes, you can still have low blood sugar levels, and you're not even a diabetic patient. Okay? So that is what we are discussing. Why should I'll discuss, we have two types of hypoglycemia, two types of low blood sugar levels. We have the reactive and non-reactive low blood sugar levels. I've discussed that already, and what are the causes. So it is not for those that have diabetics that will still have low blood sugar levels. Even though you're not a diabetic patient, you can still have low blood sugar levels. All right, so that is why it is important to make sure your liver, you don't have any liver disease, your immune systems are functioning properly, you don't have any kidney disease or anorexia, okay, and nervousness. All those things can cause you to have low blood sugar levels. All right. Let me see what other questions that are here. Actually, I'm going to on the AC now because I'm burning here. I'm burning here. Okay, so do we have any more questions to go? I'm waiting to see if we have more questions to go, and we'll take it from there. All right. Okay, friends. If we don't have any further questions, I'm going to let you guys go. We've been here for an hour plus. But the bottom line is that the purpose of this video today was to discuss why should you have low blood sugar levels even though you're not a diabetic patient. Okay, so we've discussed the causes of low blood sugar without diabetics. Okay, and I believe those questions that were answered today are good. I enjoyed those questions that you guys asked, and I believe you guys are going to take note. So anytime you see that you have a low blood sugar levels and you're not diabetic, do not panic. Just check to see if there are any certain medications you are taking that is causing you to have low blood sugar levels. All right. Check if you have any severe infection or if there's any major organs that is. So that is why you have to seek doctor's consent to, investigate to find out why you're having low blood sugar level, even though you're not a diabetic. But it do happen. So I advise everybody to make sure that once you arrive at this destination of having a low blood sugar level, try to make sure you consult your doctor to find out why you are having a low blood sugar level. Okay? So that is where we are today. So I'm not going to waste much time. I'm going to post the video on my page. I'm going to break them down and post them. For those that are joining us now, when I post the video, you guys can now watch all the clips in there and get your message. And then if you have any further questions, you can send me those questions. All right? So meanwhile, I thank you guys for your time, and hopefully we are going to see you again. Bye-bye.